The Transition Clinic right across from United Regional is a prime place for patients who have just been cleared to leave the hospital. But sometimes managing your health condition after leaving is the hardest part. In tonight's Healthy You, I show you how you can stay on top of your diagnosis. It may seem like the doctor is speaking an entirely different language as you listen on from your hospital bed.
Sometimes when you're in the hospital, there's just a lot of things coming at you and you really kind of need to digest. And so you may have picked up on one word. So they may have said heart failure. And then you're home and now you're like, well, what is heart failure?
The United Regional Education team is there to make things make sense.
Anyone who has been recently admitted to the hospital for COPD, diabetes, any kind of heart failure or sepsis, we really recommend that they take these classes or their loved ones.
United Regional Community Health Nurse Amy Pontius-Smith teaches survival skills classes along with other nurses. They're free and every day of the week.
Whether it's medication management, make sure that they're weighing themselves daily. Really, it just tailors to that patient. So whatever they've just learned, now we take that information and then we just try to help them manage at home.
Like most things these days, virtual classes have become a big hit. Pontius-Smith says, though, you decide whether you take the class face-to-face, through a screen, or by phone.
The virtual classes are through a secure network, through Microsoft Teams, and it is an appointment. So if someone is interested in taking a class virtually, they will actually call, make an appointment, and we have a slot just for them.
The classes cater to you and your specific health history and new diagnosis.
Heart failure is kind of a broad term, and they can have heart failure because of different reasons. And so it doesn't mean that like my heart is stopped. It just means it's not working as efficiently. And so with proper management and medical treatment and follow-up, it can prolong their life and their health status.
And it all comes down to these action cards. The #1 skill taught is how to know when it's a good day versus a bad day, and then be able to manage both.
After you've taken a class, your symptom awareness is so important so that each day when you wake up, you can decide, am I in the green, the yellow, or the red? And then you know what action step to take so that you're taking accountability for your health.
Classes aren't just for K through 12. Learning about your health condition can be the difference in living a long and healthy life.